Greetings. Well, I finally have a real diabetic nurse. It took a very long time. Um, the last video I did, I talked about having this conversation with the diabetic nurse I had at the time, and I was frustrated. I wasn't happy. I've worked with her for 6 or 7 years. Rarely has she been what I will say nice. There were a couple of times where I got some good advice from her, but other than that, we just didn't get along. And I just think that she really believed that because she had a bunch of years doing the work, that she was going to be kind of an authority person. Whereas I've worked in healthcare for now 45 years, and I'm thinking, nah, you ain't getting away with that with me. Heck, wait a minute. Yeah, 45 years, that's about close to it. So I was supposed to have an appointment with a diabetic nurse, a new one, because the other one retired at the beginning of December. So I'm supposed to meet the new nurse. And then they had to cancel because she was sick. And then nothing. No one was, contacted me saying, hey, we need to set up another appointment. Nothing whatsoever until it was time to reorder the Dexcom 7. And I told them, I haven't seen anybody since last August, because supposedly to get the Dexcom 7 to have it mailed to you or to be able to pick it up at the store, you're supposed to see a diabetic nurse or doctor every 3 months. So that didn't happen. So I finally put something in the portal again, and I mentioned it. Next thing you know, we scheduled an appointment. So I had that appointment. It was about 3 weeks ago. And I probably should have done this video earlier, but it doesn't matter because everything works out just fine. So I go up. It's 8 in the morning. I have an appointment. Never had an appointment that early, but I had it. And the nurse came in, and she was young. I mean, probably mid-30s, somewhere there. That's different. And I had a feeling things were going to change because she came in. She's all lit up or whatever. She's very friendly. She's smiling. I'm like, okay, well, this is something different. So we sat down and we had a conversation. And she actually listened to me. And she asked me questions and waited for me to answer things. And it was interesting because we talked about how, I would have these different things happening to me. I wasn't necessarily sleeping well. I figured that out, by the way. And how the job I have now, where it's part-time, Wednesday through Fridays, but I don't often have a chance to get any kind of lunch. I could, but I'd have to drive far to get to a place to get some kind of lunch. So I'd usually just skip it, and then I have those issues and whatever. And so she said, well, can we look at the number that you have on the Dexcom 7? And, we want to know what your password is. I don't have a password. She says, you don't? I said, no, because I never wanted to be tracked. That was just one of my things. I always had that. I didn't want to be tracked. I didn't want someone contacting me saying, hey, we've been looking at your numbers and we think you ought to do something. I don't need that. And it was funny because then she says, I'll be right back. And so she walks out. And then about 3 minutes later, she comes in with another nurse. And the other nurse says, well, we don't track people. I said, you don't? She says, no. She says, what we do is if we've got certain things like this happening, or if you call us with a question, then we will ask if we can look at the data that the Dexcom is giving you, and then maybe we can make a decision. Well, someone could have told me that before, but there you go. So that was one thing that went nice. And then I'm talking with the regular nurse, and she came up with a new plan because I was telling her, my eating patterns and how they, vacillate. And one of the things she said is, okay, let's try this. She said, if you can find a way to eat something in the morning, because that's also a problem, but, I think I'm working on that, McDonald's, but I'm working on that. So she said, if you can eat something in the morning, then we're going to increase the amount of insulin by 2 or 3 units. So, because I'm not giving the number out, but she said, we're going to increase that. And then if you can eat dinner earlier, plan it, because I told her one of the things I have is I have an alarm that goes off almost 8 o'clock at night asking, did you eat yet? And she says, that's a long time between whatever you have at lunch or dinner, or if you're considering lunch at 5 or 4 when you're getting home, and now you're eating something else, no wonder you have higher numbers at night, because I do, and then sometimes I crash, but you know. So she said, if you can eat something earlier in the day, we want to have you take a bigger dose, and then around 5:30, if you can eat your next meal, then we're going to bring that up to the normal number that you've been using before. And then that will give you more time because you're taking 70-30. So early on, it's coming fast, and it's, you know, it's more effective, 70-30, where the 70 is fast acting and then the 30 is slow. And she said, you know, if you're doing that, because you've said that you usually have dessert between 8:30 and 9, which is true. The one thing I get right is dessert. So she said, if you have that dessert, then the long term would be okay, because the 70 will have brought down your glucose some. And so let's see how that works. Well, that has actually worked. I've missed it a couple of times, but in general terms, I've been doing exactly that. I've been eating dinner earlier. Like I said, that was something I had to get used to, but I'm eating dinner earlier, and then I'm still having my dessert, for the most part, between, I'll say, 8 and 9. And I haven't had any real highs. I've had some lows, but not super low. You know, I've had some 90s, but they didn't wake me up, because with the Dexcom, if you have a low and it gets to a certain number, then you get the alarm, and then it wakes me up, and then it's hard to get back to sleep because you got to do something about it. But in general terms, everything is going well. I'm not upset with that. I'm not upset having this new, younger nurse. This is fine. You know, this is one of those things I used to tell people a long time ago when I was working in hospitals, and my employees would say, you know, we're trying to say these different things to the nurses, and they're wanting to battle with me. I said, you know, we will try to have these conversations. If you can't have those conversations with them because they don't want to listen, let me know. I will go have a conversation with them. And if I need to, I will go talk to their supervisors, because we all need to work together to get something done. And that's what I saw with this. So I think that for the most part, I'm good. I was happy with this. I'm not necessarily sure I'm happy about 8 in the morning all the time. Let's move that up to 9 maybe, but still, that's just it. So if you're not communicating with someone, you might need to ask if you can have a different nurse. Don't feel any shame. I never thought about it, to tell you the truth, which is why I'm mentioning it. Because had I thought about it, I probably would have been able to get a different nurse who I would have a better rate of communication with. So there it is. So we'll see how it goes. I'm probably not going to mention it again unless something really bad happens until maybe the end of the year. We'll see how it all goes. For now, that's what I have. My name's Mitch. Good talking to y'all. Hope you have a great week.